Hello there. My name is Puneet. I'm one of the GP. I'm working in Australia, precisely in Canberra, and I'm working as a GP last 5 years already. I did my GP training here. Let me give you some background of myself. I graduated in 2001 from Russia. So yes, I did study in Russia. Now, my journey to Australia was quite a bit unusual. I came to Australia in 2004, and but not to practice medicine. I came to study some different science-based courses. I did occupational therapy, and by doing it, it was easier for me to get permanent residency visa at that time. But over the time, it has become quite hard to get permanent residency. But I was very lucky to get it. I started my AMC preparation in 2009. So from 2006 to 2009, I was working as an occupational therapist in hospital settings, which actually gave me quite a good experience in terms of learning local culture and local English slang, which you don't know when you first arrive into this country, and you have no idea what sort of slang the locals are using. You have no idea their sense of humor, so which is very important to understand. Also, to learn the hospital setting, because it's very important the way they practice medicine, or what kind of system they have in their hospital settings. So by working as an occupational therapist, I got that experience. So I started my AMC training in 2010, and got my internship in 2011. I was very lucky to get internship even after just part one and English language test. So while I was doing my internship, I was preparing for AMC clinical exam, and I was lucky enough to pass my AMC clinical exam. So I worked at least for 4 years in hospital setting before I decided to get into GP training. Then I did my GP training for 3 years, and now working as a GP in a private setting. GPs over here, they don't they are not salaried doctor. They work for a private clinic, or they have their own clinics. So for example, me, I work for someone. I work for a private clinic on a percentage basis. So whatever the billing I'm doing, I normally get 70% of that billing every fortnightly. Yes, and then I pay taxes, obviously. Which is quite good actually. You earn good amount of money while working as a GP in this country. GP is a fascinating. It's quite fascinating as a working as a GP, and I really love it. GP is not what we are used to back in my country. For example, I'm from India, and where anyone after passing MBBS can call themselves as a GP, but GP itself is a postgraduate qualification, and you do see everything: pediatrics, gynae, psychiatry, women's health. I do pap smear. I do look after women with issues, their periods, menopause, psychiatry, depression, anxiety, bipolar disorder, just to name few conditions. Also in medicine, rheumatology, respiratory medicine, you just name it and you'll see everything in GP. And sometimes obviously you need specialist input, because you as a GP you cannot manage everything. So if you have any patient which requires specialist input, then you write a referral and you send to a specialist, and then specialist will organize further investigation. So my job as a GP to take a history, proper examination, investigations, and come up with a conclusion of what I'm thinking, and then you send to specialist whether anything can be done, or is there anything you want to add, or you want to try, you want to start a new treatment, because as a GP, as I said, you just don't know everything. You need to know everything, a bit of everything, but you can't. But you just don't know everything. Okay, so it's a bit complicated. Yeah. So I thought in my first video, I just share my experience, what I do in here, and you can ask me questions about working as a GP in this country, in Australia. I'm more than happy to answer your questions. You can email me as you want. My email is in the description. And yeah, what else I want to tell you? So this is my room, and I'll give in next video I will show you around my clinic, so that you know where I'm working. And then you can ask me questions. So basically, I can answer your questions about the AMC exams, how to prepare for AMC, how to work in this country as a GP. There are some different pathways for overseas trained doctors, and also doctors from Russia. I mean, when I would say doctor from Russia, anyone who studied in Russia, just like me, I can give them some tips about what to do after their MBBS. Because I know in India, you have to do MCI examination, which is a very, very difficult exam. I mean, I can tell you this, but that exam doesn't test how good you are in medicine. That just tests your rote learning, how good you are in memorizing some stuff, which in my opinion, it's a very bad exam as compared to PLAB or USMLE or AMC exam, where they focus on your clinical skills, on your medical knowledge, which actually requires for patient caring. For patient care. For example, how to treat asthma, not as compared to the size of trachea. I mean, who cares if you don't know size of trachea? But I care if I don't know about how to treat asthma, because this is basic. So that's what you need. Yeah. So ask me any questions. I'm more than happy to answer your questions. Okay. Till then, bye. And in my next video, I will definitely upload my room, where I'm working, and things like that. Okay. Take care. Bye.